Everyone. So today I am going to demonstrate how to do a laparotomy dressing. That will be basically a training for surgical residents because I've seen that surgery residents face a lot of difficulties and they have modified the laparotomy dressings themselves using watch pieces and everything. So I just want to demonstrate how to do a standard laparotomy dressing and vein dressing for a patient of laparotomy. So here we have a patient of laparotomy. He is a young aged male who was operated for perforation peritonitis. A stoma has been given. That was he had a perforation in ilium 2.5 feet proximal to ICJ. So a stoma was given and a laparotomy was done. So this is a typical laparotomy dressing that our residents do, and this is a drain dressing that our residents do. But actually, this is not correct. So I'll show you if we come across such a dressing, how to address such things. So first we'll use these loose gloves. These loose gloves. We'll not use sterile gloves from very beginning. We'll use these loose gloves to open the dressing. Because I've seen residents wearing sterile gloves and opening the dressing from those very sterile gloves. So first I will use these loose gloves and I'll just open all the dressing of this patient. Okay, so here some sutures have been opened. There is some collection for this patient. So I'll open this dressing and throw it in the dustbin. And then I'll open the drain dressing that is actually not correct, not correctly done. So I'll open this also so as to demonstrate the correct technique. Okay, so once we have opened all the dressings, we'll throw this in the dustbin. So we will have our one assistant who will assist in our dressing. So now the work of these gloves is over. So we'll remove these gloves and throw them. And now we use the sterile gloves to proceed. So once we open the gloves, for our surgical residents, basically the inner part of this gloves, this glove packet is sterile. So we open this glove packet. We'll wear our gloves with a no-touch technique like this, and we'll just touch the inner surface of this surface of the gloves packet because it is sterile, not the outer part, and we'll use the no-touch technique to wear the gloves. So now this surface of the gloves packet is sterile. So basically we can touch anything here, we can keep anything here. So we'll keep it here. Ideal thing would have been a trolley or something, but our surgical residents don't get it, so we'll use this part. So we'll ask our assistant to provide us with some watch pieces and some pads. So we get here some watch pieces, more watch pieces, we got pads also, and some more watch pieces. Okay. So first part of the laparotomy dressing comprises of painting of this part. So we'll use, first of all, we'll use some spirit. So our assistant will put the spirit on this without touching my gloves or anything from a distance. Okay. So we'll use this gauge piece. We'll not touch the gloves with the skin initially. We'll use this gauge piece to clean the skin around the stitch line and paint it up to a distance as we do a laparotomy painting. We'll clean all this part till the drain. So first we'll do it with the spirit, then we'll sew through this watch piece. Then we'll use the second watch piece and put some betadine on this without touching anything with our glove. Then we'll use the same technique. We'll again first paint it with the betadine, then we'll paint other parts of the abdomen with the same watch piece till the drain. And we'll remove the gauge piece. We'll throw the gauge piece. The next part is that we'll take a thick pad and make it into a roll like this. Now here comes the part of a second assistant. So I'll ask my assistant to wear the gloves for me so that he can assist me. I'll be needing some more pads. We should also be wearing the glove with the no-touch technique. So we'll be handing over one pad to our assistant so that he can soak all the collection that comes out through the midline dressing. आपको ये पकड़ना है and जो भी collection है साइड में आपको hold करना है. So this should be a thick pad. Usually our residents, some residents start doing like this, one hand dressing, and they keep gauge piece. This is very inappropriate and very incorrect way of dressing. Some residents use this small gauge piece and start doing, and the pus starts falling to the opposite side. So these are not the correct methods. There should be assistant who will be soaking all the collection, and you should make a thick pad because our aim is to absorb collection from all this area near the laparotomy bone. So if we keep this pad like here, so the collections from this point, and the midline all will come out through the stitches that have been opened, and our assistant will soak the collection. So I'll start the dressing. So we will be rolling it from both the ends. अब अगर कोई कलेक्शन निकलेगा आप उसे सोक करिएगा, है ना. आप यहाँ रख लीजिए पैड अपने हाथ से, बस रखे रहिए, है ना. So we'll be rolling. So as you can see, the collection will come out from this place and it will get absorbed inside the dressing, inside the pad that we are rolling. So we will roll it like this. So you can see this, it has absorbed the collection from here. So we'll do it multiple times. Some patients have a lot of collection, so it is very important to take out every part of the collection from the dressing like this. Multiple times we roll till the collection comes out. And we'll roll it from bottom to up also, like this. Sometimes the collection is at the top and it comes from the top stitches. Okay, so there was not much collection in this patient. If the collection would have been much, it would have come out and our assistant would have soaked this collection. So now once we have taken out all the collections, we'll throw this gauge piece. Now we'll again use a beater and we'll paint this part once again like this, just the middle part, not the entire part this time, and we'll throw this gauge piece. Now we'll take multiple gauge pieces and open the gauge pieces like this to keep it on our dressing, so that if any collection comes out throughout the day, it will get absorbed in this dressing. The number of gauge pieces or pads depend on the collection that comes out through the wound of separate patients. So this patient, there is not much collection, so we'll keep 4 pads like this. And for the drain part, we'll take a betadine gauge piece again. Betadine. So for drain side also, we'll clean the drain side with the help of betadine like this. And we'll throw this gauge piece. We'll apply a gauge piece. We'll open a gauge piece, make it into a thin roll, and we'll roll it around the drain side. Like this. Okay. Then we'll remove our gloves after this step. We'll remove our gloves. The dressing is over. We'll not apply tape using our gloves because it gets sticky. We'll throw our gloves here. Then ideally we should be using a 2-inch micropore for this kind of dressing. We have here is a 3-inch micropore, but we'll do the dressing somehow. So we'll take out the micropore and then we'll apply 2 strips of micropore from above and down like this, so that it stays. And we'll cut it here. We'll take another strip. And while applying it, we'll leave a very little space in between open. We'll not cover the whole part. Like this. We should have been a little more down, but that's fine. So we'll leave this little space open here. Now for the drain part, the dressing of the drain is very important. Our residents don't actually know how to do a drain dressing. I'll show you. So first, we'll just cut a micropore. We'll make a space here in between, and we'll apply on this side like this. Okay, so that this covers the gauge piece over the drain. We'll take a similar tape, this size only, approximately this size. We'll again make a space in this gauge piece, in this microphone, and from the opposite side, we'll apply a dressing. Like this. Next part will be to create a mesentery so that the drain does not get pulled out. So we'll take 2 bits of tape again, and the length of the tapes should be sufficient so as to hold the mesentery at place. So we'll take this tape, we'll fold the tape at its end to create a mesentery like this, and then over the drain like this. So it is very important that the portion of the tape that is placed over the drain, at least 2 times of the tape should be below the drain over the skin so that it keeps it at its place. So like this. So this portion is over the drain, and this portion will not let it pull the drain if sometimes we get the stretching. Hold this. आप इसको बस पकड़ लीजिए, इसको बस पकड़ लो सही से. हाँ. So we create a second mesentery again. Sometimes while you're sleeping patient, if the patient takes turns, the drain tends to pull out. So it is very important to do a perfect drain dressing. These drains are very important in an laparotomy patient. So now this part we have again folded, and we'll match end to end with this, like this. So as to make a perfect mesentery, and the lower part of the tape will stick to each other. So this part of the tape will not stick to each other. The lower part sticks to each other, and again that will go at the back of this towel. So this should be a perfect laparotomy dressing. And with this drain dressing with a mesentery, if you want to open, we'll just open like this. We'll pull both these ends, and we can do the drain dressing again whenever we want. And this is a perfect laparotomy dressing. So I hope our residents, our surgery department residents, or the other department residents will follow such kind of dressing with a very sterile technique, because if we do dressing in an unsterile way, we can infect these wounds. That may lead to burst abdomen and other complications. Hope you like this video.